All right, good morning, everyone. Thank you for joining Health for a Change, Tackling the Immunization Crisis. My name is Allie Wells. I'm the Communications Director for the Foundation for a Healthy Kentucky. We are very honored to have some wonderful speakers joining us today. We have Dr. Christopher Bowling with the Kentucky chapter of the American Academy of Pediatrics, Jesse Sanders with the Kentucky Rural Health Association Immunize Kentucky Coalition, and Kelly Talby with Kentucky Voices for Health. Before we get started, I just have a little bit of housekeeping I want to go over. Closed captioning is available during this webinar. We also invite any questions you may have. You can type them in the chat box at any time during the webinar, but we will hold all questions and address them at the end of the presentations. There are also no pre-approved CE credits attached to this webinar. However, I can provide a certificate of attendance for those of you joining today. So you can just put it in the chat if you would like one, or I will be sending out an email when this webinar is over, and you can just respond to that saying you would like one. First, just to tell you a little bit about the Foundation for a Healthy Kentucky. We are a nonprofit, nonpartisan organization that aims to create an environment where every Kentuckian has what they need to live a healthy life. We want to make the healthy choice the easy choice. And to do that, we try to reduce disparities and improve policies and programs on the state and local level around our two focus areas, which are access to care and children's health. Our first speaker today is Dr. Christopher Bowling with the Kentucky chapter of the American Academy of Pediatrics. He is a volunteer professor of pediatrics at the University of Cincinnati College of Medicine. He co-founded the Pediatric Associates in the northern Kentucky suburbs of Cincinnati in 1992, which became one of the largest single specialty pediatric practices in the country. He retired from Pediatric Associates in 2022, and we are so happy to have him joining us today. Dr. Bowling, you want to kick us off?
Absolutely. Thanks a lot, Allie. It's a real pleasure and an honor to be here. As Allie said, I'm representing the Kentucky chapter of the American Academy of Pediatrics. We're a group of about between 75 and 80,000 pediatricians nationwide, setting policy, advocating for child health, much like the foundation does. I'd also like to put a special shout out to a friend and colleague, Beth House, who is a pediatrician in Lexington, for all of her help with today's presentation. When we talk about the vaccine crisis, what are we really talking about? How are we doing in Kentucky? Well, this is not just a Kentucky issue, obviously. This is something that is going on nationwide. It's really something that is affecting everybody from coast to coast. And it's not going to take long before we see the effects of falling rates of immunizations. We're seeing some decrease across the board, again, from coast to coast, border to border. People kind of have this, I think, this false view that like, oh, nothing's going to happen. We haven't seen these illnesses. Well, from experience, we know it does not take much for when the tender is thrown in the fire pit. It doesn't take much of a match to get things started. So we don't have to drop very far in order for us to start seeing effects. We really know that COVID has had a number of effects on us with the vaccine crisis. And you're going to hear some stuff from Kelly later today, where the goal here is maybe keeping some of the anti-vaccine sentiment isolated itself, because there's a lot around the COVID vaccine. We really do not want to see it start affecting other vaccines as well. And the COVID vaccine, I'm not saying anything against the COVID vaccine. It's fantastic. And we need to be pushing it as well. But we really need to try to keep the other vaccines from getting into the same controversy. It's really led to a distrust of public health across the medical system. I've done some advocacy on other topics, and it just seems like it's really public health and medicine in general has really taken it on the chin with regard to people fighting back and really not trusting. We're experiencing it in Kentucky more than other states, and let me show you how we are doing across national standards. There's one resource that I would like to point out to you. This is a really fun, interactive, and very informative map that comes from the American Academy of Pediatrics. You really click on a state. This is just a screenshot. But if you click on one of the states, you get information about how that state is doing against national averages. And also too, the exclamation points and the orange triangles here indicate where there's an active outbreak going on at that moment. So it's a lot of great information. I encourage you to see it. If you really just go to aap.org and check for vaccines or immunizations, you'll see information on this. So when we drill down on that site, what do we see? Let me orient everybody at first. I don't know if you can see my cursor here, but the green lines where it says 90%, 90.8% on those first two lines, those are the healthy people targets from jointly from CDC, NIH, AAP, where our target is to get good national community immunity. What we notice is that in general, the national average outperforms Kentucky. There is one exception on this graph, which is kind of nice to see. Our DTAP rates are a little bit higher for those younger kids. I'm going to show you another slide that lets that kind of fall by the wayside a bit. But anyway, we're a little bit below national average on most other vaccines. And when we look at flu and COVID, we actually see a significant difference, with national average for COVID being at 43%, influenza at 45%. The Kentucky averages are lower and significantly lower, 5 percentage point lower for COVID, 10% lower for influenza, which is really kind of a scary one on the national level. This puts us at a composite rank for these two vaccines, a composite rank of 45th nationally. If we look at routine immunizations, unfortunately, that DTAP advantage that we had with younger kids sort of evaporates, and we go below the national average when we look at the 5 doses of DTAP. It's a little bit confusing to look at these rates because every state defines it a little bit differently. So it makes it a little bit challenging to compare. But in general, if you look at it, we are significantly below the national average. We usually come out at around 30, between 39 and 46 on most measures. So we're struggling in Kentucky. We used to be a little bit better than the national average, and we're struggling some. When we talk about that COVID effect, that blur that we just went through from 2020 to 2022, the national averages on MMR, we're just looking at MMR here by school year. We see a drop nationally from 95.2 to 93. We really see a drop in Kentucky. We really experienced a major drop from 93.1% down to 86.5% on MMR. If we just and this is representative of other vaccines as well, but I chose MMR here because this has got some recent and some current implications for all of us in Kentucky and nationwide, because we're seeing some outbreaks of measles nationwide. We're ahead of last year's entire total already at this point. If we look at the national rate, and I want to point out a few things here, the line at the top, the red box there, if you see that 95%, that's what we need for herd immunity. And if we notice the national average here, we're at 93.1% on the national average. And in Kentucky, we've dropped down to 90.1%. If you look also to one of our more important neighbors, Ohio, is even lower. So we are susceptible, and there's an active outbreak in Ohio. We are susceptible, to say the least. So what's this really look like on the ground? I always love this picture. This is a picture of me with one of our PAs, Brady. Brady is also not only one of our PAs, he's a former patient at Pediatric Associates, my practice of over 30 years. Great guy. And anyway, what were Brady and I seeing in the office? Well, when you're in the office, it's really hard to not get defensive. And I can tell you some of the principles I'm going to talk about that we try to follow in the office to try to correct and try to fight back against misinformation. I have failed miserably. Sometimes I continually think back on one horrifying experience I had with a patient like Brady. She was a patient of mine from a very young age. And I assumed that, like, oh, certainly she's going to believe me just by telling her what the great Dr. Bowling has to say on this issue. They really don't. I mean, really, she had been following a lot of misinformation, had a lot of questions, and I really got very defensive, and it was a terrible experience. One that I wish we could come back. We all get defensive. It's really hard to not get defensive. And a lot of times what you think will work doesn't always work. You have to be you're humble daily in practice and around immunizations and something that feels so basic and so central to what you do. Sometimes you're fooled. It's remember you also want to remember too. A lot of you know me from the other work that I do mostly, which is around nutrition and obesity. I'm a big believer in working with the movable middle. You can really get frustrated if you're trying to work on the really most hardcore. You really want to focus on those people that you're going to have a chance with. And I want you to remember that motivational interviewing is your friend. Now, I could do a 2-day course or more on motivational interviewing. I learned motivational interviewing over a week-long intensive course in Minnesota. So I'm not going to manage to do much about motivational interviewing in 90 seconds here. But I do want to remind some people about some principles of behavior change that motivational interviewing teaches us. One is that effective behavior change using MI honors autonomy. I always say that MI gets you away. For me, it's getting away from Catholic guilt. It's not my issue. This is the patient's choices. It honors their autonomy in making decisions. It relies on their internal motivation. No matter how much you want something to happen, they're not going to do it unless they believe it's important. So you have to know what's important to your patient in order to trigger that motivation. And it's always collaborative. So, as much as we think that it's write a prescription and they're going to do what you want them to do, it is not the case. Decision making around vaccines, around all other healthcare issues, and we know how much behavior change affects health, is always collaborative. It's also important to think about the sequence that decision making follows. The four processes of MI are really sequential, and it's important that you go to each step first when you're having a discussion about behavior change and you're trying to lay out a case for why something is a good behavior change. Number one, you have to engage. You have to know your patient. It's not the be all end all, as I mentioned earlier, but it's important. It's important to do those things that you would take time to really get to know your families. You want it to be guiding. I mean, you have an agenda. You want your patients protected. So there's a real goal. You're not just kind of talking about things in general. There's definitely an endpoint where you want your patients protected. And again, you have to remember that decision making is an evoking process, meaning that the choices they make are going to be based on their own values, their own standards, and their own understanding. So you really want to evoke within them things that are going to help them make good decisions. The planning phase that we all want to jump to immediately with decision making is the fourth and final stage. Like, here's how we do it. Here's our vaccine schedule. Here's how this will go. Here's what we want to watch for, etc. Don't go there first with a family that is hesitant. Frameworks is a wonderful organization and a wonderful website if you're not familiar with it. And I want to go through a few examples with frameworks. We're going to go through them very quickly, but it's an AAP endorsed website that really helps you kind of understand some principles around this. The principles from frameworks are pretty basic, and they mirror a lot that I just mentioned in motivational interviewing. First and foremost, think about how you want the family to view you. What do you want to be to them? In general, we don't want to be looked at as a dictator. We want to be looked at as a trusted advisor. Take time to understand their mindset. You're going to be much more able to help evoke in them values that really will help them make healthy choices. Don't shy away from collective benefit. I think it's very different when we're dealing with kids than adults. With adults, we tend to think, this is me, talk to me, I make my own choices. When it comes to kids, parents have other friends and kids who, through no choice of their own, have immunosuppression, are on chemotherapy, are too young to receive vaccines. Collective benefit works with families and younger kids. Position yourself as a neutral, trusted advisor. Respect their autonomy, as I've already mentioned, and a couple of really nuts and bolts kinds of things. Reframe as positive where you can, and use the terminology that vaccines train the body. What do we mean by this? Well, let's talk about putting some of these things in practical use. Instead of thinking about people being anti vaccine or anti vax or anti vaxxers, think about them as people who have absorbed misinformation about vaccines. They're not their only persona is not as an anti-vaxxer. It's the way we, in terms of obesity world, this means we talk about a patient with obesity, not an obese person. They're more than their illness, they're more than their attitude. You want to also point to the misinformation as being the issue, not their understanding of the misinformation. It's a little bit of a difference there, but you want to target more the misinformation that they're receiving and not their interpretation of it more than their symptom. Avoid military language because we do it all the time. Vaccines are a weapon, vaccines are helping us fight disease. Well, when that doesn't work, that sounds like it was a failure of that shield. Instead, use termination like preparation language. Vaccines prepare our immune system to recognize and resist disease. When they think about vaccines actively fighting disease, they worry more about the risks of not being protected. So we all know that sometimes when we prepare for things, things still happen. It's not a failure of the vaccine. It's just sometimes our preparation isn't enough. Replace herd immunity. People don't like to think themselves as a gazelle or a buffalo or a cow. We want to be thinking more about network immunity. And one of my favorites is community immunity. Now, frameworks will say they like it because it rhymes and it's easy to remember. I think it also plays to that sense that we're part of a gang, we're part of a community. You're helping protect those other kids who are not able to protect themselves with immunizations. Try to avoid natural immunity, natural immune system, and just say the body's immune system. The issue with natural is it can sometimes indicate that vaccines are then artificial, and it can also lead people to gravitate toward herbal supplements instead of immunizations. Replace vaccine hesitancy with vaccine confidence. Again, this is a subtle difference where we're focusing more on the positive of what we want rather than what we're afraid of or what we are trying to battle against. So it's great to say, I have real confidence in this vaccine. I've been using it for years. And you know what? When I was growing up, we saw Haemophilus influenza B. I took care of kids with that meningitis. I have great confidence because we don't see that anymore. One final comment that I'd like to make too is vaccine versus immunization. There's a couple reasons why when we're talking with families to use immunization instead of vaccine. The purist will tell you that vaccine is actually a word that was derived from vaccinia or smallpox. It also is a little bit of a dated term. Immunization really speaks to what we're trying to do in training that immune system, in updating that immune system, in rebooting and reinforcing that immune system. So we, in general, like the term immunization more than vaccination or vaccine, even though in this audience, we'll use them interchangeably. Remember, Kentucky AAP is here to help. We're always there, and Ali will be happy to share my contacts and those for Dr. Hawes, who is our immunization coordinator at the end of this program. So thanks, everyone. With that, I'll turn it back to you, Ali.
Thank you so much, Dr. Bowling. That was great. Our next speaker today is Kelly Talby, the Director of Communications and Development at Kentucky Voices for Health. Prior to joining KVH in 2020, Kelly gained more than 13 years of experience in Kentucky state and local government sectors. Some of her previous roles include serving as the Special Advisor to Louisville Metro Government and Policy Advisor for the House Democratic Caucus of Kentucky. Kelly, you want to take it away?
Thank you, Ali, and thank you, Dr. Bowling. We planned today's webinar, obviously, but I don't think I saw it until he just did his presentation, how much we were going to complement each other today. So that's exciting. I'm Kelly Talby. I'm with Kentucky Voices for Health. You can go on to the next slide, Ali. For anyone unfamiliar with KVH's work, just briefly, we are a statewide nonprofit, nonpartisan coalition of consumer health advocates. We specialize in uplifting real Kentuckians' voices in the decisions that impact their health. We aim to identify and also address the root causes of poor health outcomes through policy advocacy, and that takes shape in a myriad of ways. Go on to the next slide. So I'm going to talk to you all about some of the more tangible substance behind state policies, not just in Kentucky, but on a national trending scale to what Dr. Bowling was alluding to, and what that is looking like as far as its impacts and what maybe some of these immunization hesitant populations might be fearing. But I also want to uplift a lot of access opportunities. There is a tremendous amount of work being done and areas where we can apply a little more intent to address some of these issues head on. So, at no surprise to everyone in this room, I glanced at the attendee list, and there's a lot of biological minds, epidemiologists, public health leaders. You all are acutely aware that we are in a very turbulent space. Dr. Bowling was alluding to that and giving phenomenal recommendations from frameworks and AAP on how to approach these conversations. But you have something to keep in context is you have entire families that don't talk to each other anymore, friends that have lost connection simply because of the positions they took during the pandemic on immunizations. We've seen studies put out relating immunization status, death rates, and the political letter beside your name. It is an extremely impassioned space, and we've all eaten a large pizza. We're on a plane. The seatbelt is too tight, and the ride is going to be turbulent, but we have to get to our destination. We cannot look away. So, on a national scale, what do some of these state legislatures look like as far as the policies they're implementing? I use the National Academy for State Health Policy to kind of snapshot this for you. They're a national level nonprofit, nonpartisan agency, and they've got a lot of cool data sets and maps. You can see exactly where Kentucky falls on some of these things, but it is largely isolating COVID-19 out from all immunizations in the anti-immunization policies. There are some pro-immunization policies, and I'll talk about one of those here later today, specific in Kentucky. Go on to the next slide, Allie. In Kentucky, what do some of these state policies look like? These are bills that were filed in Kentucky's 2024 regular session that did not advance. Many, many bills and resolutions, immunization specific and otherwise, are filed every year and do not actually get heard in committee, voted on, or discussed in an official capacity. Many of these are repeat places or organizations like KVH. We've kind of been monitoring a lot of bills the last few years, but knowing that they weren't going to be discussed or move at all, we have not really acted or felt the need to engage and speak up on them. Some of the new ones, though, I want to flag for you here. And if anyone's interested in more details in these, I have a whole slide deck available. Just let me know. House Bill 41, that was a new one this year, and a prohibition on immunization incentives, and that would apply just for all Kentucky immunization incentives. So there goes your value added benefit structure that MCOs use. There goes your gas cards that you hand out at immunization clinics, or your swag bags at a health fair where people get their flu shots. House Bill 177 also raised a lot of eyebrows because of the no basic immunization education definition for coercion. You had pediatricians, health departments, school nurses kind of questioning, could they not even hand out a pamphlet with information about a communicable disease and immunizations available to individuals? So again, I think it's important for the public health space in Kentucky to be very familiar with the bills that are being filed year after year. These were in a monitoring way, and going to the next slide. Senate Bill 295 is a bill, however, that did advance this year. It did not pass, but it did advance, and is kind of a warning flare for the ecosphere, for KVH and other organizations in this space, that we just need to pay a little closer attention. In its original form, it would have banned immunization requirements and mandates, not just for COVID-19, but for modRNA and mRNA vaccines. That kind of goes into stifling for vaccine research and development for viruses we don't even maybe know about yet. So it did get diluted down. It was amended before it passed the state Senate. However, now on Kentucky's official record, we have commentary that was used in the state Senate from largely debunked misinformation resources through VAERS and other Reddit comment posts. And it was kind of an awkward debate. Again, a lot of those comment sections that we saw go a myriad of ways in the last few years were said out loud in a more formal capacity, and that's concerning. Going to the next slide. So about the misinformation and distrust that Dr. Bowling was speaking to, this quote here I thought really encapsulated maybe the tone of the situation that we are all facing. This is Paul Offit. He's the Philadelphia Children's Hospital Vaccine Center director. And he, if you're ever available to listen to him speak or read anything he publishes, he doesn't mince his words, and I really love that because it is a space where we're not used to it. I think you see a lot of individuals, both on the provider element as well as the family element, who have not thought about immunizations in the way that we need to revisit those conversations. And I'll talk a little more about that in a minute. But I think you have these misinformation principles trickling into our mainstream conversations. They're now passing state laws built on those misinformation principles, and it continues to carve out trust in our providers, in our healthcare system, and it can be even incremental. Anytime we add an additional opt-out or exemption for immunization policies, that's just another kind of carving away at what the provider is offering for you. And I'm using this worldwide measles graphic for two reasons, because Kentucky actually has a success story that I wish more people would speak to on some of the exposures and outbreaks Dr. Bowling mentioned. You know, last year's Asbury University revival, kind of a textbook super spreader event, if you really think about it, and then the headline hit about an exposure, but it fizzled. And we were extremely pleased to see that, because when they did the contact tracing and everyone that had that direct exposure at that event was in large part up to date on their MMR, and the vaccine shut the virus down. There were some kind of dismissive attitudes last spring when that happened, and kind of dismissing, saying, oh, the measles isn't so bad. No, the measles is really, really bad. The vaccines did their job. But none of us woke up this morning and said, man, I am so grateful that Nana didn't go blind yesterday from a communicable disease. We don't think like that. Immunizations do their job, and we stay healthy and we go about our day. We have other things going on. We don't focus on whether or not our vaccines are working for us. However, measles is also taking a turn for some very troubling rhetoric in our comment section that I hope does not enter the official space. But it's been the last few months nationally discussed because we know in America we eradicated measles in 2000. So people are starting to question, why are these outbreaks and exposures happening, and not looking at the declining immunization rates, and instead blaming it on globalization and that it's being imported in. And any time in a politically divisive atmosphere, we want to other. There's a big otherism, and we're professionals at propaganda in America. And it has started to been said out loud that individuals coming to America from Mexico is how these exposures and outbreaks are happening. And that's simply racially undertoned, and we cannot allow that type of otherism to take place here. It will only further harm our immunization uptake for MMR, and we have to apply anti-racist attitudes. And when you look at the actual global vaccination rate, Mexico's kicking the United States' butts on its 1-year-olds being up to date on their immunization. So I can make an argument that they are absolutely, undeniably not to blame for that. Going to the next slide. An area where I think in Kentucky, to use as an example to what Dr. Bowling is talking about with routine immunizations and how the COVID effect is maybe trickling in a little bit. If you take note of our hepatitis B birth dose rates right now, and I want to say this slide with a big asterisk, our 2023 data is incomplete, which is there's a lot of reasons for that. You have home births, you have a lot of manually reported systems. There's large delays in why some of this data will be incomplete for a while still. But what is noteworthy is that red column in the middle. From 2022's births in Kentucky to 2023, there's already a sizable increase in children who are just born that did not receive that Hep B birth dose rate within the first 24 hours of being born. I can say proudly that in the 2022 yellow column, that 2 of those babies are my own. I had twins in 2022. But I can also tell you, I do not personally recall that conversation happening. I have no doubt that a nurse or doctor came in and talked to me about it, and that if you pulled the paperwork, there's my initials or signature consenting to them receiving those vaccines. But I think that while there can be some attention drawn towards pediatricians, family physicians, providers, capturing those babies at their week, 2 week, or month-old well checks and trying to catch them up then, I think a conversation can be had in Kentucky to go ahead and integrate a lot more targeted upstream prenatal conversations and make sure that birthing people understand what that first 24 hours might look like. I had an unmedicated birth, but think about individuals who have medicated or C-section births or any other circumstances that might be chaotic. And if they are now in this ecosphere where maybe they have always received their immunizations, but they have reason to pause now because of concerns developed during the pandemic. If that first conversation is happening in the hospital shortly after giving birth, I can understand and see why some of these rates might be changing. We do not have empirical evidence to support what those conversations look like yet. But the numbers, I think, speak for themselves that we do have kind of a bright red orange flag appearing at us for our newborn babies. And go on to the next slide. So, you all work in data-driven, evidence-based areas. You all have minds that speak about data on a day-to-day basis. So why can't it be enough? Why is that just not enough on its own? You know what the numbers say. And you heard Dr. Bowling talk about words and tone and how we approach that. And I'll kind of reinforce a little bit of that. And then I also want to uplift what we can be doing, what you all can maybe be thinking about and integrating into your work. On to the next slide. In 2022, KBH facilitated a series of listening sessions. We felt strongly that the hesitancies and lack of confidence among Kentuckians was probably going to look pretty similar to what we were hearing and seeing on a national level. But we wanted to be able to stand by that in academic terms. And so here's our key findings. And you can see here that COVID very specifically is driving a lot of the lack of confidence. It's the polarizing point. But that Kentuckians have bigger needs than getting vaccinated. And it's that same issue of maybe you have a gutter that's leaking or tires that need to be replaced or grocery visit. There's all sorts of things that get in the way of your day-to-day interactions, and you don't necessarily think about whether or not you need to go get a booster shot for something. And also the source of culturally competent health messaging is clutch on whether or not it will be well received. And go on to the next slide. As far as our recommendations, and if anyone's interested in the full slide deck and breakdown of our listening session findings, it's linked here on this slide. Routinize, personalize, diversitize, opportunize. We have to continue beating the drum on routine immunization schedules, and we can't look away from COVID. It has to continue to be talked about. We are so close to the event of the pandemic. In 20 years, we will know so much more about long COVID, about vaccine development, and who knows what variation of the virus will be around us then. But we cannot look away, and we just have to continue integrating it into our everyday speak for routine immunizations. Those personal conversations, that is our opportunity to identify someone's personal battles. But maybe they have diabetes, maybe they're afraid of needles. There's so many different reasons on why we have opportunities to validate someone else's experience, be it concerns or they are very excited about a vaccine. Diversitize. We must integrate trauma-informed care and culturally competent approaches in everything we do. I'm going to use one example of how we can do better here. I've seen a large growth in organizations and companies wanting to use multiple languages for their materials and resources, and that's perfect. We should. There are dozens and dozens of languages spoken in Kentucky. However, I've seen kind of a checking of the box by using like a Google Translate service or generic AI system that doesn't necessarily take into consideration how some English language does not translate into other languages, Spanish and otherwise. And so we, I think, need to be a little more sensitive to the variations of not just language, but how other families might interpret it, the conversation to begin with. Opportunize. While we have to be patient with ourselves and each other, we still have to be persistent and consistent. So Dr. Bowling shared an interaction that he had that didn't go well. We're going to have off days. I might have an off day. You might have an off day. We might have off days together. Mark that in your notes and still revisit the conversations. We can't walk away and kind of, because it's uncomfortable, not do what we should do. Going to the next slide, Allie. And I'm going to really braze through these because I'm about at time already. I'm sorry. This is just a resource slide to kind of reinforce time flies when you're busy as all get out. I think maybe with a little more intention on putting your tickler reminders on your calendars a little sooner could go a long way. I'll use the maternal RSV shot simply because it's one of the newer ones. As an example, if you have individuals and clients in your care that are 18, 20, 22 weeks pregnant in June and July, and you're not having the conversation about maternal RSV shots that will be available to them after September, we're late. We need to integrate these conversations much sooner than they're actually available to people. That includes back to school, respiratory season in general. I'll go on to the next slide. This is an immunizations through the lifespan guide that we developed last fall. Please use it if you enjoy it. Use it if it inspires you to create your own. I just feel that sometimes we forget that clinical terminology doesn't always translate. I've been in several spaces recently, actually, where varicella is thrown out casually, and I have to remind myself, like, which one is that? And you say chicken pox, and I'm right there with you, and I fully understand and follow and can talk about it for days. But we felt that maybe just a little more relatable content would help families go a long way. Go on to the next slide. This slide and the next slide, you can go on. We're going to breeze through, Allie. Our frameworks content, the American Academy of Pediatrics put out. I cannot agree with Dr. Bowling more on how valuable their resources and content are as far as reframing how we think about these conversations. Going to the next slide. If you're not already plugged in, please consider using the public health as a toolkit and resource for their alerts, their resources. We have a whooping cough situation. This WKYT screen grab, that's from last week. This is not old content. This is happening right now. They've got a lot of tools, and I think there's generational variations on how we interpret them. I was raised to think that you never needed a DTaP or a DTaP booster unless you cut your foot on a rusty nail. So I think there's a big variation on why so maybe our children's immunization rates are higher, to Dr. Bowling's point. Going to the next slide. Our immunization outreach page, if you don't have the bandwidth to create your own social media content or flyers, there are so many brandable opportunities here in multiple languages. And I encourage you to check it out. Go on to the next slide. So this is a pro-immunization policy in Kentucky that passed this year, and we're very excited about. Kentucky's PrEP Act is what we call it. It's a compromise between our pharmacists, pediatricians, advocates hustled on it. And thanks now to it going to effect, pharmacists can continue vaccinating children down to the age of 5. And this is huge. And if you go on to the next slide, there's additional opportunity for pharmacists to consider that if you know pharmacists, if you work with pharmacists, if you're just a busybody like me and you insert yourself in lots of conversations, talk to them and make sure that they are offering immunizations to the Medicaid population. Their reimbursement rates just increased last fall. Go on to the next slide. The Vaccines for Children's program. This is an area where children, similar to the 317 program for adults, if you are uninsured, underinsured, we have a tremendous amount of resources to get more VFC providers. There's your contact information. They can help you. These folks are amazing. I adore all of them. I've talked to all of them. Go on to the next slide just to run the point home on why we have a need, though. This is from May of last year. So while some of these numbers will have changed, we still have so many counties that have one, maybe two VFC providers, and we've got to encourage that. And Allie will talk about an opportunity there later. Next slide. Another area where we can focus on access and increasing immunization uptake is, I want to encourage you all, if you're not already using a certified CHW, look into it. Recently, Kentucky passed laws and regulations went into effect last summer that make CHWs Medicaid billable for many services. And they are a catalyst, if you go on to the next slide, for being the epitome of the trusted messenger. And we have a couple videos here from CHWs in Kentucky who talk about their experience talking with their clients about immunizations and what that actually looks like. On to the next slide. Medicaid covered transportation. This is available, non-emergency medical transportation is available to all Kentuckians using Medicaid for their health care, and it is wildly underutilized. I won't get into the details about that necessarily here. Going to the next slide. But we are in the process in Kentucky of improving the regulations to make NEMT services more efficient and better for Kentuckians. And here's an explainer if this is helpful for you in letting your clients and patients navigate their transportation barriers and needs. Go on to the next slide. If you use the Kentucky Immunization Registry and you've not checked it out recently, there's a new look. They have new resources, there's new FAQs available. We want this to be a better tool and resource overall. Go on to the next slide. If you're enjoying kind of my very 30,000 foot viewpoint here, check us out. We do a roadshow and a virtual program throughout the year. We have a big in-person kickoff in Frankfurt next week. Go on to the next slide. And I will just close kind of with a call to action and reminder for all of us here. You know, immunizations help keep our children and families out of poverty. It's fewer sick days from work and school. It's fewer disabilities with lifelong consequences. It's fewer chronic health conditions. We can have a little more intention behind the words we use and the approaches and the yearly perennial events that we host. Insert yourselves, be the opportunist, make sure that everyone has the materials you have before them, and a little intent goes a long way. And I just really appreciate any questions you all might have.
Thank you so much, Kelly. Real quick, before I introduce our next speaker, I have seen a couple questions about if these slides will be available when the webinar is over, and they will. I will make sure everyone gets a copy so they can have all these great resources available to them. So our last speaker today is Jessie Sanders, Health Communicator Program Manager at the Kentucky Rural Health Association's Immunize Kentucky Coalition. Prior to this role, she was instrumental in outreach across the state and other programs at the Kentucky Rural Health Association. Jessie is going to talk to us about the coalition and how it works to increase immunization rates and some of its resources. Jessie?
Hi, everyone. I just want to thank you guys for being on this call, and thank you, Allie, for inviting me to present on the Immunize Kentucky Coalition. As Allie said, I'm Jessie Sanders, the Program Manager for the Kentucky Rural Health Association Immunize Kentucky Coalition. Next slide. A little bit about us. So the Immunize Kentucky Coalition is a program associated with the nonprofit Kentucky Rural Health Association. We focus on creating a healthier Kentucky through immunization education and awareness, establishing health needs, and striving for health equity. Next slide, please. Really, so like I said, our focus is statewide partnerships, tangible results and resources, continued education that we offer trainings on, consistent messaging, and ultimately health equity. Really, our focus is to be a trusted resource throughout Kentucky. So we want to provide whatever materials or resources that we can to help immunize Kentucky Coalition grow and for immunization rates to continue to grow in Kentucky. Next slide, please. So our mission and vision. Our mission is to address vaccine preventable illnesses across Kentucky by creating a network of partners promoting health equity. Our vision is to work to increase immunization rates and prevent disease by fostering a partnership of Kentucky parents, patients, providers, businesses, healthcare organizations, and others by promoting health equity that support the delivery of safe and effective immunizations through stronger community buy-in and public health education. Next slide, please. So our partners and collaborators, IKC's engagement to 455 different professional contacts on a regular basis, in addition to KRHA membership. So KRHA alone has 800 members, and on top of that, we have 455. So we really try to utilize all of our contacts and keep them updated monthly on everything that the Immunization Kentucky Coalition is doing. Another partner that we have is the Kentucky Department of Public Health. We work with local health departments. We work with Kentucky Voices of Health closely, and associations and foundations such as medical, nursing, pediatrics, primary care, health plans, school-based, pharmacy, colleges and universities, pharmaceutical, and residential facilities. One of our primary focuses is colleges and university outreach. Right now, across the state, we have about 10 strong partnerships. We host events regularly there, and we continue to grow that number. We're hoping by the end of this year, we'll have many more universities that we're able to get connected with. Next slide. So our online resources, this is really what we try to focus on. For events we have coming up, actually, we have 3 regional symposiums. These symposiums will be in Hazard, Paducah, and Somerset. Actually, I'll touch on this, but our next symposium is going to be May 17th in Hazard. So what this is a training event that we're offering on improving the health of children. So it's primarily going to focus on childhood immunizations in the morning, with really the objectives of increasing knowledge on state regulations, giving, childcare facility workers, we want to give them the resources to be able to check on the KYR website to see about the children that they have, and keep them updated on regulations. And then that afternoon, we're actually offering a nursing vaccination program. So we'll be training nurses that are still in nursing school, or nurses that have recently graduated, or if they just want to get more comfortable with childhood immunizations, we are going to be training on that as well. So like I said, that'll be May 17th, and then our others are in August. And then we also have a summit coming up October 9th. So that'll be an all-day event in Lexington, and that's going to really touch on health equity as well. We have a dashboard online. And actually, this is a little bit behind. I made this presentation last week, but as of the last couple of days, on our website, we have resources translated in English, Spanish, Swahili, Burmese, French, and we're working on getting it translated in Haitian Creole as well. So we've noticed that across the state, these are the primary languages that we have. So we continue making resources translated. Right now, we have, I think, around 20 different vaccination flyers in all these languages onto our website. And our website also can be translated into all of those languages. So if their browser is automatically set to Spanish or whichever, it'll automatically transfer over so they're able to view our website. One of our more recent projects that we just actually have underway is our Ask Me Anything forum. And this forum is basically, it's almost like a Reddit for our website. So people can go on, they can ask right now it's childhood vaccine focused, but they can ask a question, and then obviously we're able to make sure it's appropriate to be posted onto our website. Once we approve it, we've actually partnered with 10 providers across the state to be able to answer that question for them. We really want to push the trusted resource out online. So instead of going to Facebook or going to, any kind of social media forum, that they're able to go to our website and get the answers that they need and find a provider near them. Our social media, we're very active on Facebook, Instagram, and LinkedIn. And then a couple advertisements. So we have a Spanish and English radio ad going out. I believe we have one that came out last month, one this month, and then we'll have 2 more radio stations promoting this radio ad in August through October. So this is really going to be touching on RSV, COVID, and flu vaccinations. And then we also have billboard advertisements across the state, and those will be going up also through August and October. So we're really excited to have those going out. And those will also be in Spanish and English. Next slide, please. So like I said, upcoming projects, we have an interactive map coming out. So this map is going to include location, hours, contact information, and immunization information on providers across the state. So we've had a data collector who has been calling providers actually for the last couple months across the state. I think at this point we have around 2,000 providers that have been able to get approved on this, so that you can go in and you can find a local provider near you, search your address, and be able to find one that offers whichever immunization you're looking for. Or if you want something specific that's not offered in your area, you can find something near you. So we're really excited to get this project going. Like I said, we're still collecting data on that, and we expect for the map to be posted onto our website in October. Next slide, please. So like I said, upcoming events. So we have our Hazard Symposium, that's May 17th. Our Somerset Symposium is going to be August 8th. Our Paducah Symposium is August 23rd. And then our IKC Summit is October 9th. Registration is open for all of those at this point, and registration is free for our symposium. So we would love to have you guys involved. We are offering continuing education for physicians, nurses, community health workers, daycare facility workers, and social workers. So it's an all-day event, and we have partnered with the Kentucky Department of Public Health to help us have this presentation happen. So we're really excited to have it. Next slide. And here's all of our resources. You can scan that to go directly to our website. And if you have any questions or you'd like to get involved, feel free to give me a call or an email at any time. Thank you, guys.
Thank you so much, Jessie. So if you have any questions for our presenters today, you can go ahead and start putting those in the chat now. Before I get to them, I want to really quickly tell you about 2 grant opportunities happening right now at the Foundation for a Healthy Kentucky. First, we know the importance of enriching our state's health data and how that will help inform interventions to improve access to care, including immunizations. So our first grant program, it's been mentioned a couple of times by our presenters. It's related to the Kentucky Immunization Registry, KYIR. And we are partnering with the Kentucky Department of Public Health for this grant program to support provider electronic health record, or EHR, connections to the Kentucky Immunization Registry. So we are granting funds of up to $10,000 per location of, for example, pharmacies, long-term care facilities, and other immunization providers who wish to make that connection. These funds can only be used to cover the provider's EHR and for the cost of staffing needed to complete the integration of data. And these grants are for new connections only, not pre-existing ones. You can scan that first QR code to find out more information, and I will also include links in an email when this webinar is over. If none of that made any sense to you, that's okay, because this is a very specific grant for vaccination providers who will be more familiar with some of those things I just mentioned. So if you are not a vaccination provider and you don't know what that is, that's okay. And hopefully you've learned a little bit about the registry today. Our other vaccine-related grant program right now aims to educate minoritized communities about adult vaccine recommendations and/or provide an opportunity for people to receive these immunizations. So some examples of projects may include educational outreach, creation of promotional materials, door-to-door campaigns, or hosting an event where vaccines are promoted or administered. Preference will be given to grassroots projects that target under-resourced populations or populations with historically low vaccination rates. And these grants will not exceed $25,000. That second QR code will take you to the information for these grants. And again, I'll include all these links in an email after the webinar is over. So we can get into Q&A right now if we have any. I think most of the questions that have been coming in, we've been typing and answering. So I'll just give it one more minute for people to put questions in.
While we wait for any hesitant folks to type their questions, I did want to point out Kimberly's comment, if anyone didn't see it in the answered section, about the rhetoric around autism specific to MMR vaccines. And if nothing else, I think it just speaks volumes to how misinformation, once that toothpaste is out of the tube, it has very long-lasting effects, detrimentally so, because that's now a decades-old misinformation cycle that predates social media, and it is still causing us problems.
I
And I'll
respond.
let Dr. Bowling talk about
Yeah,
that.
I responded to that one too, Kelly, because it's just, that study. I mean, I'm very free about talking about how it is um, about how, that is a study that was absolutely debunked, that it was one that was, he took money in order to falsify data. Andrew Wakefield did. I mean, it's completely debunked. We've spent millions and millions of dollars demonstrating that is not the case, and it continues to come back up just over and over and over again. Once it's in there, as you said, it's like the toothpaste is out of the tube and you can't put it back in. So yeah, it's really difficult to know what to do with that.
Yeah. Well, it looks like we don't have any questions. We have lots of thankful audience members, and I'm very thankful to all of our presenters today. You all did such a wonderful job, really great information. So thank you for taking the time to put these presentations together. Like I said, this was recorded. I'm going to send out all the resources, and I hope you all have a great rest of the day. Thank you.